The first antibody on the market was an antibody against the CGRP receptor, erenumab or Aimovig. The second antibody to be approved by the FDA was against CGRP, rimonabant or Ajovy. The third antibody to be approved by the FDA is galcanezumab, which is again against the CGRP receptor. The last antibody under development is an antibody against the CGRP itself and does not yet have a brand name. The current CGRP antibodies are indicated for the treatment of migraine in adults. There are studies being done for cluster headache and for post-traumatic headache, but that's the current indication. How do they differ? The antibody called Aimovig is against the CGRP receptor. That is where CGRP does its business. The other antibodies are against CGRP itself. All drugs are effective. The side effect profiles are slightly different, and the weight at which you can inject them are different. But we're really excited that we have 3 and possibly a 4th soon antibody for the preventative treatment of migraine. In this day and age, what we use in clinical practice more often than not depends on the insurance companies. If the insurance companies make the drug available, we'll use it. If it doesn't make it available, it becomes very difficult to use it. Since the first antibody, erenumab, came out, we used it first. And it took about 4 to 5 months till we got the second antibody. So we have the most experience with erenumab, and then the second antibody with rimonabant. And the third antibody we have less experience with just because of the sequence. I believe we have over 1,000 patients on the antibodies at this time. And here's my bias. Just like in the trials, they work half the time. When they work, they're really great. And many of these patients have failed everything. The dose of erenumab or Aimovig is either 70 or 140 units or milligrams per month. I picked the higher dose because the price is the same. And if you think about it, there's no risk in giving a higher dose, and there's always a chance you'll get a better response. Monthly, 140. The second drug to be approved was rimonabant or Ajovy, and the doses are 225 milligrams every month or triple dose every 3 months. Many patients don't like to self-inject and like less frequent dosing, so in most of our patients we tend to be using the triple dose every 3 months. The third antibody is again galcanezumab, which is given on a monthly basis. These antibodies come in pre-filled syringes, so they're given at home by the patient.